But by the way, I don't have a watch. I lost 2 watches. I lost the gold watch for my son. I lost the watch for my father. I don't have a watch. Okay, you tell me when you want me to stop. Okay, just stop. I'll stop right away. Okay, I mean, just tell me. Okay, you want to stop anytime. Okay, where are we now? Oh, I might lose again.
Just for now.
Somehow I can't keep watches. I keep somebody. I don't know what happened to me. My son bought me a very expensive watch. It's gone. I said, well, somebody lucky person got it. That's fine. Where are we now? Are you laughing at me? Eh? Thank you. Now, this is double. When we talk about double vision, means to have a big picture, dealing with 5. Who am I? Am I my authentic self? Am I my real self? Why am I in this world? What on earth am I doing? Where am I going? What is the direction or purpose of my life? What is the meaning of suffering and death? How can I find meaning and happiness? For meaning-centered counseling, we intentionally address issues. Now, my friend Judith Weiser might not know about that. I have worked with the professor from USC, Jim Barron. And we have worked together on autobiography, guided autobiography, and life review. So we conduct life review sessions with senior, with elderly. Now he's now in UCLA Medical School. So we'll conduct a lot of workshops dealing with life review. Now these 5 questions pop up all the time. Some people, when they are in retirement age, they still do not know who they are. They still know whether they have really actually lived. They let it go away like a blip on a computer. They do not know they have lived. So for meaning-centered counseling, we intentionally, whatever the problem is, can always connect it with one of the 5 big questions. So that will simply provide active significance, active understanding of the local problem. Okay, the next question people ask me, what does meaning mean in meaning-centered approach or meaning-centered counseling? Well, meaning means M-U-R-E, pure. First of all, meaning means purpose. Something means purpose. So meaning and purpose, okay? So many purpose. What is your direction in life? Where are you going? So meaning deal with purpose. Second, meaning dealing with understanding, the cognitive meaning, right? The first is existential meaning. The second is understanding, okay? Understanding. So double loop learning. And understand the meaning of words, the situation, understand yourself, understand other people, understand the situation, understand the problem, the nature of the problem. That's understanding. Now, the third part, Frankl talk a lot, I think AA also talk about that too, is Frankl always says that responsibleness, right? Remember? Responsibleness, do not ask what you can get from life, but ask what life demands of you. That's what Frankl said, okay? Do not ask what you can get from life, but what life demands of you. To live a meaningful life is to respond to what life demands of you. Right? To respond to what life demands of you. Responsibleness. Ken Ha talked about that quite a lot earlier, about assuming responsibility to make amends, to restore relationship, to examine yourself, to do what is right, and to do what your calling is. Everybody has a calling. Everybody's here for something. You just have to find it. Whether a carpenter or artist, like my friend here, or filmmaker, God gave us a gift. Everybody's a gift. So ministry and counseling is perform responsible action. Now, I went to Hong Kong twice. You know who invited me to speak over and over again? Or the psychologists, medical doctors. Okay, but the group that's most keen on meaning-centered approach is occupational therapists. So I was a keynote speaker for their association, and also hired by the hospital authority to train occupational therapists. So I said, I'm just a psychologist. I don't know anything about occupational therapy. So we like your stuff, okay? I said, why do you like my stuff? They said, see, we are struggle every day with people who are paralyzed, who are injured, who are senile, who are depressed. And they don't do anything, they're veggie, they're vegetable. Yeah. We want to help them to do something to make their life meaningful. We want to create meaningful tasks for them to perform. For example, like rehab, occupational therapy. They have to try to regain their motor function. They have to do exercise. Many patients refuse. They say, I know that I'll be paralyzed for the rest of my life. Why do I struggle to regain the use of my hand or my arm or my leg? They don't see the point. They don't see the purpose. They don't see the meaning. They say, help us how to restore a sense of meaning, purpose to these people. Help us how to design some activity, some action, something that makes the daily life more meaningful. If you have a purpose, if you understand the situation, the action principle is how you implement your purpose, right? Implement. You have to do something to implement, to follow up on your purpose, to follow through on your understanding. So the action principle is very important. What are you doing here? See, like American counselor will say, hey, Bob, how do you feel today?
Oh, pretty good.
Hi, Kim, how do you feel? Now, in meaning-centered counseling, do not ask that question. Well, but not very much, okay? We ask, what have you done with your life? What have you done with your resolution? What have you done with our agreement last time, okay? Show me. What action have you taken? Oh, but what do you mean by that? What do you mean by that? Oh, something happened, I can't do it. What's more important, your own life or your past life? It's a different flavor. American psychology, way too much emphasis on feeling. How do you feel? I ask, what does that mean to you? Have you done anything about it? What will be the responsible action in that situation? What will be the responsible thing to do? What is responsible? I recognize that you are not alone. Your action has rippling effect to your loved ones, to the community, to society, and to God. What will be the responsible thing to do in that situation? Have you done it? Why not? Why not? What's important? Why doing something is important to restore you to a life of sobriety? Why is it important to restore your life to fulfillment? Without action, it doesn't happen. Without action, you'll be just playing games with yourself. Wasting my time, wasting your time. I say, unless you're interested in action, don't talk to me. I mean, one famous psychiatrist, I forgot his name. After the Second World War, he was asked to help to do group therapy for the veterans after the Second World War. Okay, Bion, B-I-O-N, Bion, okay? Psychiatrist Bion. And he refused to indulge them. He refused to help them. He just observed. They got very mad with him. He said, "You are hired psychiatrist. How are you doing anything to help?" He just sit there. Oh, thank you. I'm tired. Say there. He just sit there. Will not say boo. Will not react. Will not do anything. And he just observe. He discovered 3 groups. The emotion focus group. All the time about emotion, okay? How you feel, I feel bad, how you feel angry, they all share the misery. That group get nowhere, get worse. The emotion focus group get worse because they wallow in their self-pity, in the emotion. Get nowhere. The solution focus to solve each other's problem slightly better. Slightly better. You know why? Because there's no leader, right? There's always some self-appointed leader, this leadership need, right? I can solve your problem. I can solve a problem. I understand your need. This is what you need to do, okay? Invariably, no sooner had the person appointed himself leader than he was shut down by the rest. Because he was not able to deliver the expectations. He set up high expectations. I can solve your problem. But when he cannot solve the problem, they turn on him, they crucify him. So basically, the problem solvers set themselves up for crucifixion. Okay? Guess which group works best? Is the project-focused group. The project-focused group, when people meet every day, they will, what project should we undertake today or this week? When they take actions, doing creative work, constructive work, when they use their different talents, cooperate, try to do a project, they forget their depression. They forget their anxiety. They forget the misery. They forget the loneliness. They get better. Action. Creative action. Responsible action. Productive action. Not talk about feeling. Not what is solving the tiny little problem. Do something meaningful. Do something meaningful. Okay? What happened? The fourth one is examining values. You can't get away from values. Ken can talk about virtues. A more neutral word will be values. Values. Positive and negative value. What really matters in your life? What really matters? Sometimes you have difficulty explaining meaning. Meaning means what's most important in your life. What do you really want in life? What matters to you most? Suppose your house is burning down. What do you take with you? Most people say, I take my family album, right? I take my family album. Do you know why? Oh, precious memories. In my life. Without the pictures, there's no past. The past is gone, but the past is captured in pictures, right? Yeah, exactly.
It's footprints of your life that point not just where you come from, but where you're going.
When you get older, the past matters a lot, right? Your life. Otherwise, you only live in the moment, you're frozen in the moment, you have no past and no future. You're suspended in life, you're not going anywhere. You're like a two-dimensional figure. Like one physicist, one physicist, he wrote a book called Time Account to Albert Einstein. Now, if you're just present, you become a two-dimensional figure. No future and no past. So you be very shallow. And so what you have to examine value. That's why for addicts to recover, they really need to clarify their value and discover what they really want. For example, here's a picture for you. There's one homeless addict, in East Vancouver, downtown East Side, Vancouver. The reporter interviewed him. He said, "How long have you been on the street?" "Many years." Aren't you sick and tired of a homeless life, of a life as a drug addict? He said, I'm sick and tired. I want to get back to mainstream. Okay? But why don't you, right? Why don't you do something and get back to the mainstream, rather than spend the rest of your life on the street? He pulled from his pocket a little picture. He said, "This is my son. This is my son. If anything can get me off the street, off drug, will be for my son." Right? So he valued his son. In local therapy, called the local hook, right? So that picture of his son will be hooked, right? Your son. He valued his son. Everybody has something to value. Nobody values nothing. Often Franco will say, when people complain and say, "Oh, I have nothing to live for, I want to kill myself." Franco used to say, "Well, how come you're still here? Why didn't you take the fatal step?" Invariably, there's something left that they value. Invariably. Either the aging mother or their children. Or invariably, there's something holding them back. And then Franco has a case to build upon that and try to revive their passion for living, reason for living, reason for get well, reason to stay out of drug. So value is a turning point for people getting off drug.